So this week, your articles and your readings are about doing research in special education, thinking about the scientific method, and thinking about those steps that we could use to find the best possible practices for a problem that we have. So, in the Odom article, we talked about the CEC, and so just kind of a backtrack on that. The CEC is the Council for Exceptional Children. It is the largest special education professional development professional organization. It's something that you should definitely look into as a teacher in special education if that's the field you're going into. They have a lot of different divisions within it, so you can focus in different areas, whether, like, for example, this one's a division of research, but there's one for autism, there's ones for teaching or education, there's one for early childhood, um, and a lot of different ones to kind of look into. They all have conferences, they all have journals, they all have materials that would be really beneficial to practitioners in the field. So the CEC Division of Research had a task force, and they identified for special education the two main or four main methodologies, and those would be experimental group, correlational, single subject, and qualitative research. And throughout this course, you are going to get to know each one of these a lot better, and so this is just kind of your overview right now. And so special education is one of those hardest to do science. It's not a hard science where you have a lab and you have different materials that you can test, but you're working with people. And you're working with a variability in your participants. We all know that when we talk about kids with disabilities, we're talking about kids who have different levels of ability, and not one child is just like the next child. So when we're thinking about variability of participants in our research, we're also thinking about a variability of educational context because a lot of our students are not always in the same type of classrooms. It varies across state as far as what types of classrooms they have. It varies across students about students who might change placements. So it's really difficult for a researcher who's trying to follow a student, especially if you're trying to do some kind of longitudinal study that follows someone across time. But then there might be a combination of settings. So there could be self-contained, and then there might be some inclusion, and then there might be some pull-out resource. So it's really just hard to say what is exactly effective because we want to ask the question, for whom is it effective and in what context? And like I said, that variability makes the science of research and special education that much more difficult, but it's really important. And so we know that if we have improved research, this leads to improved teacher practices. So if we have high quality research and we can rule out other possible explanations, we have confidence in our findings, we could use this to improve how we inform teachers on best practices. So when we have quality indicators for our research and we have good research going on, we have a rigorous application of the research, and then we also are able to take whatever we learn from our research and provide guidelines for researchers. So everything you're learning as a teacher right now has come from a researcher before who has looked at this, has tested this, and said these are the best ways to teach. Again, education in itself is very variable. So you may have like a toolbox of ideas, and then you might have to test them to see if they're effective with your population and in your context. So let's think about it for a second, though. Why do you think research is not getting into the hands of practitioners as quickly as it should be? We have all these researchers at all these big time universities that are doing research in education. However, it's not trickling down to um, our it's not trickling down to our teachers as quickly as we would like it to do. And so I'm going to introduce you to this, and some of you have maybe heard about this before, but there is what we call a research to practice gap. And so it's very, very long. It says here it's a 17-year odyssey. And if we're thinking about um, research. Here's our basic research. Here we're looking for priorities of funding. Then we start our research, and in order to do research, it costs money, right? So we have to apply for grants. And then we have peer review of grants, and we have conducting the research. We have then it takes a little while to publish something. So when I submit an article to a journal, it takes a couple of months because I have to have peers review my article before they decide whether or not it's going to be published. So that's one piece of the lengthy time. So I could finish a research study a year ago, and it still is in the process of getting published. Then we actually take all those research studies and we do what we call a research synthesis, which would be taking all the individual studies, because now we have all these different types of evidences out there and conducted, but yet now we need to take that and put it, it's what you'll actually be doing for this class, would be conducting a research synthesis, a literature review, taking what we know and summarizing it and making a statement about what do we know about this particular practice, for what population, for what context. Once we have those research synthesis, we then have these guidelines for evidence-based practice. And so now these research articles have to meet these high quality indicators in order to be something that is referred to as an evidence-based practice. So there has to be a lot of research done so that we can say, yes, that is an evidence-based practice. And then we also have to get those articles into ways that teachers are going to find them, right? So we have practitioner journal articles that I'll introduce you to throughout the semester. That really takes what we do in the research world, kind of puts it into language that is going to be accessible to a teacher. And then that's when the practice becomes an evidence-based practice, right? And it's in the hands of teachers. But this is a really long process. So you started reading the Rubin Bellamy book this week, and we're going to start talking about the steps in the evidence-based practice process. And so there's a couple different ways, and throughout the semester, we're going to be using these steps to really find our answers to the questions that you're interested in. So there are 5 steps, and especially these are for thinking about intervention effectiveness. First, we need to formulate that question. We need to search for the best evidence. We have to then critically appraise the evidence, and that's where we're going to spend a lot of our time, is looking at articles and figuring out whether or not they're good, high quality studies. From that, then we select the intervention, and then we have to develop some way that we're monitoring the client process, student process, anybody who you're intervening with. So step 1 is question formulation. Before you start searching for research evidence, you need to know the type of question you're trying to answer. So formulating your question will help you guide your search. So different questions are best informed by different types of studies. And so when we know what type of question we're asking, then we know what type of study we might either be looking for to appraise or be looking for to design in the future. And so here are the 6 types of evidence-based practice questions, and we're going to kind of keep going back to this because as you write your question for this course, it's going to be one of these 6 questions. So first we might think about what factors best predict desirable or undesirable outcomes. So if you want to know what kind of factors might predict a student who has high reading achievement, or what factors that might predict increased engagement in the classroom. This might be one of your questions. What can I learn about clients, service delivery, and targets of intervention from the experiences of others? So these would be like your interview questions, your interview focus groups, your qualitative research questions. So if you want to know about something about service delivery, about an intervention, and you are solely going to look at the opinions or the experiences of others, this would be a question that you might ask. What assessment tool should be used? So if you're looking for a specific way to assess some skills, some behavior, some academic achievement, you want to look at what assessment tool should you use. And so picking an assessment tool shouldn't just be kind of out of the blue and you have no idea of any of the background. You should actually have some idea of what it is that there is some of the research involved in some assessment tool. what intervention program or policy has the best effects? This is probably our most often asked question in special education, because we want to know what kind of intervention, what kind of reading program, what kind of math program, what kind of behavior program has the effects that we want it to have. Do we want to increase positive behavior? Do we want to increase reading? Do we want to increase engagement in a certain subject or whatnot? You want to know which one has the best effects. What are the cost of interventions, policies, and tools? We also know that schools are in essence a business, and we have money, and we need money to implement interventions and programs and whatnot. And so we want to know what is the most cost effective ways to intervene. And so that might be one of your evidence-based practice questions. And then what are potential harmful effects of interventions, policies, or tools? It's kind of like the opposite of number 4, where you want to know what has the best effects. You might want to know if you're going to do some kind of intervention, what are some of the harmful effects that could happen? Step 2 is really looking at the evidence. And so we want to search for research evidence, which actually can be a challenging step for practitioners. We are going to have a whole class on just searching for evidence. And so this is going to be something that hopefully will be easier for you down the road, but it's something that teachers a lot of times don't even know where to go find that evidence. So there are some free search engines, Google, Yahoo, Bing. They're helpful, but they're limited. So these search engines often turn up links to biased resource. You might only find titles and abstracts rather than full text or articles. So you know that when you search Google, you're going to get a lot of maybe resources that aren't evidence-based, resources that don't have a really good solid background. So we want to figure out how we could actually look for evidence that's high quality and helpful. A lot of times these search engines for research articles are fee-based. Right now, as an App State student, you have all access to the university library, which actually gives you a lot of access to journal articles, and we're going to again talk about how to find those. But an alternative option is to utilize reviews. And that's what we talked about in that research to practice gap, where we review the literature. You might not need to read every single article about a subject, but you may be able to read a synthesis of research that might help you give some ideas about what would be some of the best practice. And so here's some useful websites. The Cochrane collaboration and Campbell collaboration have a lot of free reviews on certain subjects. You might find a little bit more in the Campbell collaboration, Cochrane. Sometimes in special ed you can find, especially in autism, but it's a little bit more healthcare focused. But these are free websites that you can go to. And my advisor from UF actually works for Cochrane and does reviews for them. And so I know that they're very rigorous, and they have very strict guidelines about what they publish, and they don't publish multiple different reviews. If you're selected to do a review for Cochrane, you are bound by some certain formats and certain high quality standards that you have to write these reviews. So they are very reliable sites to look for information. Other helpful websites, these are regarded resources that provide reviews, the APA, National Center for Post-Traumatic Stress. There's other places that you can look for that would provide free access to literature reviews. Sources that provide access to full text or professional literature, you might look at the National Institute of Health, Medline, PubMed Central. And one that a lot of people don't know, and we will look at again, is Google Scholar. Is very, very helpful, and you will find a lot of free access to PDF versions of articles within Google Scholar. So step 3 is going to critically appraise the studies and review, and we're going to spend a lot of the classes looking at how we do appraise literature and thinking about how to read a study with kind of this critical eye. So when you're searching for research evidence, you'll find a great variety of studies in regard to objectivity and rigor. You should find better studies, as soon as, the peer review process is supposed to kind of weed out some of the ones that um, are not as rigorous, but again, that's just, another way that there could be some bias. Both reviews and studies can be flawed, even when there's no vested interest or biases involved. Again, that peer review process is supposed to be there to give you assurance of the research that's been unbiased, but this also varies as well. It varies on the reviewers. And just so you know a little bit about the peer review process, for example, when I get an article to review, it comes to me from a journal, and I'm one of probably 3, sometimes even 4 journal reviewers who will read the article. I will critique, I will say any kind of flaws, limitations, things like that, but I also address like the importance of the topic to the field. And then when I submit my review, there's an overall editor who will look at the reviews and then make a decision on whether or not that article should be published. Sometimes we have what's called these fatal flaws, and that's what destroys the credibility of the study's findings. So that would be something like a really shady research method, or something that has no real evidence to back it up. A really good example of this is the study, and not to kind of go into a controversial subject, but it's one of the studies in the autism world, the first study to come out that said that autism was linked to vaccines, had ended up having really fatal flaws. And so when it came out that study had these fatal flaws, I mean, it had shady research methods, it had made up data, things like those. And then they retract that study from the journal, and it's no longer considered published. However, it's still kind of out there for people to see, which has caused this whole vaccine and autism controversy. So when a study does have fatal flaws, it is something that should not be published. But there's other research flaws that are a little more acceptable. So there's going to be no perfect research study. So every study is going to have limitations. And when we look at more research articles, you will see in the last paragraph or the last few paragraphs of every research article, they're going to give you limitations. They're going to tell you that they did all this, but here's where I'm limited. And maybe it's just that you don't have a variety of participants, or you have a small number of participants, or your measure may not have measured another concept or something like that. But the less limitations we have, the more we can really be comfortable with the findings of the study. And it's also not always easy to differentiate between acceptable limitations and fatal flaws. And so this is where it gets a little bit easier when you know a little bit more about research, and you become you get a little more practice with reading research. And that's what this class is for. It's for you to kind of get an idea of what would be high quality research. How do we notice it? What are the most important pieces of it? And how do we kind of pick and choose from that really big information source that we have of research? So the next step would be to select and implement an intervention, right? So now you've done your research, you have looked through all the possible interventions, you've critically appraised them, and now you want to make a decision about what intervention to implement. However, the research evidence does not dictate what intervention should be implemented. It's really only there to inform your decision. So remember back to our models of what evidence-based practice is that research evidence is really just one small piece of it. And you, as a practitioner with knowledge and experience about the context, about the student, you're taking all that into account to decide what is the intervention. You want to know research evidence should be weighed on balance with other considerations. So you want to know that most studies examine the intervention effectiveness at a group level. Even the most effective interventions will not work with all students or clients. And recall that individual client characteristics, preferences, and values should also be considered. And this is just really this important piece of what about the context? What about that classroom setting or that clinical setting that you're working in? There's important differences between our clients and practice contexts and the clients and practice contents included in research studies. So sometimes we want to make sure that that these things can influence the effectiveness of any given intervention or the utility of an assessment instrument. And these differences should be considered when selecting and implementing an intervention. So it's really important that if you read a research article and it says this is going to happen with this population, you might want to make sure you think about, well, did they do this in a clinic? Did they do this in a school, but in a room that had no other students in it, right? So there's different things that could be influencing why an intervention is effective in a research study and maybe not in your classroom. And so I just want to, again, point out that model of thinking about your expertise and your population, your environmental is all influencing decision making just as much as best available research evidence. So there's not some magical number of how many studies you need to determine what evidence has the best evidence. And so when you think about evidence-based practice, there are some guidelines. And so we think about it in terms of some group of experts sat down and said, this is how many studies we need to say that this is an evidence-based practice. But again, there's really no magic number. One scientifically very strong study can outweigh several weaker studies. And if you have studies with relatively weaker design, this can overestimate the effectiveness of interventions. And so it's really determined by the quality of the research study. And so again, also know that new studies are constantly emerging. So there's some change in that available evidence and perhaps the conclusions that you might make. And your last step is the monitor client progress. You have to decide what are those measurement treatment goals. And so what are you actually looking for? And those would be your outcomes. So whatever you think that should happen from your intervention is what you're going to be measuring, right? If you think that behavior should decrease or you think behavior should increase, if you think that reading abilities or reading phonics or comprehension or math ability should increase, those would be what your goals are. It helps practitioners determine whether to continue or alter an intervention. Can also enhance a student-client commitment to a treatment if they're seeing that progress is happening. That might be mostly your parents that you're trying to convince that what you're doing with a child is effective and working. And so this does sound like a lot of work, and I'm going to try to break this down into kind of this feasible process that's not as hard as it sounds. So there are ways that you may be able to cut corners and find time-saving approaches using the research synthesis that are already out there, using practice guidelines, working with a team of practitioners to share the work and reviewing the research. So kind of having these ideas, but about how you might be able to cut the corners. But right now I'm going to teach you all 5 steps so that we can kind of take it back to the beginning. And so you would be an expert on how to look for quality research in education. So another feasibility concern is determining whether you have the skills, funding, or other resources to deliver the intervention. Remember, some of these interventions take money. Researchers get grants and they use that grant to hire people to collect data and do an intervention. And so sometimes it may be harder to implement an intervention in a school that has less money or you don't have a lot of support for what it is that you want to do in your classroom. And many well-researched interventions have resources and supports for practitioners, including manuals, training, and consultation, but this could vary widely and just may be out of reach for teachers. So it's something to keep in mind as far as what is feasible in your classroom when you're reading the research. So here's just a kind of a overall diagram of steps of evidence-based practice, and I kind of liked it because it kind of gives you a little bit information about how to do the process. So you have, you're learning about what is evidence-based practice, you're asking questions, and you're acquiring information. And this is all part of the PICO, which is what we're going to talk about in class, but it's writing a question to look for. You are going to acquire research and appraise. which is where you're going to have this evidence table where you're going to figure out what is your evidence saying about the question that you're asking, and then you're going to apply it, and then you're going to assess. Okay, so this is the end of this show, slideshow. So we are going to continue talking about evidence-based practice, and starting with step 1 in class. And we're going to talk about formulating your research questions. So you should come to class with a little bit of information in your mind about what kind of topics you would be interested in looking at while you do this project across the semester. So right now, you've probably had a lot of teaching experience. You've seen some problems that happen in a classroom. And so you want to think about what kind of questions could you ask that would make a project.